So I only have two words for that, volume and resources. So for one, we have a lot of patients coming in at the medical oncology clinic at the Cancer Institute. So before the pandemic, the challenge was to give the best care that we could give and that the patients could afford. While the hospital subsidizes some of the cost of care, by and large, the cost of care is still paid mostly by the patients out of pocket. As we know, PGH, or the Philippine General Hospital, is the national university hospital of our country. And the medical oncology clinic, during the pre-pandemic setting, takes care of those patients who are under the middle and low income Filipinos. So every day, we go to the clinic and we attend to an average of around 150 to 200 patients daily. That's for the outpatient clinics. Meanwhile, we also have the inpatients that we do chemotherapy on. So we also have that at the Cancer Institute. If I can summarize the main challenges that we had during this pandemic era here at the Cancer Institute in the Philippines, I would say number one is the risk of infection, or the safety, or ensuring the safety of the patients and the healthcare workers as well. So that is the primary concern when we reopen the Cancer Institute. It is to make sure that all patients and all her healthcare workers won't get sick. Second is that, as mentioned earlier, we have limited resources, even during the pre-pandemic times. Most especially now that the pandemic is here, it's really hitting us hard. Most especially our patients. They are having difficulty in procuring medications, which are not available in the hospital. They intend to seek help, mostly from the charitable organizations or charitable institutions from the hospital. But during this time, it's really becoming harder and harder because the help does not come in most of the time. And then, of course, we have the concerns of the staff, or the concerns of the healthcare workers regarding, number one, as mentioned earlier, their safety. And then second, of course, their psychological or mental health. As we know, this pandemic has created fear, feelings of anxiety for most of us, not only for the patients, but for the doctors and other healthcare personnel as well. We are hopeful that we can start seeing and caring for the same number of Filipino cancer patients as we used to. It is a privilege to serve here at our Cancer Institute. However, I hope that the best practices, particularly the extra care and the extra effort that has been put into communicating with coworkers and the provision of supportive care, such as the counseling of the staff and the counseling of patients, will continue beyond the pandemic. I think for me, there is no one correct formula to solve the problems caused by this pandemic. We can all learn from each other. Moreover, we believe that by sharing the practices that we feel have worked, helps not only those who share our work, but ultimately helps more cancer patients as well.